Hey, I'm a neonatal clinical nurse specialist, and I often hear NICU nurses tell me that they want to advance their career, but don't really want to be a nurse practitioner, don't really feel like they have options to advance, like they're really limited in hitting that glass ceiling. And a lot of times I'll ask them, why don't you become a CNS? Have you ever wondered a little bit about the clinical nurse specialist role? Ever wondered what a clinical nurse specialist does and how NICU nurses can grow into that role? I want to share with you a little bit about my journey from NICU bedside nurse to CNS. According to the National Association of Clinical Nurse Specialists, a CNS is an advanced practice registered nurse who provides expert clinical care, leads evidence-based practice initiatives, and helps improve patient outcomes at a system level. There's about 89,000 CNSs in the United States, but fewer than 1,000 are neonatal CNSs. We're a small and impactful group, and we need more people like us to help improve outcomes in the NICU. I always like to say my role as a CNS is I work with patients and families, nurses, and healthcare systems to improve patient outcomes. That's my little elevator. I started as a new grad in the NICU back in 2009, and like many of you, I was drawn to the intensity, the team environment, and the chance to care for the tiniest and sickest patients in the hospital. My goal was always to be the best NICU nurse I could possibly be. That was always my goal. Whenever anybody asked me, what's your goal? It's like, I just want to be the best NICU nurse I can be. I want to be the NICU nurse that people ask, like, hey, what is this? What do you think? I wanted that to be me. At the time, I didn't even know what a CNS was. I'd never heard of the term. If you said CNS to me, I would think central nervous system. It actually wasn't until I moved to California that I was introduced to the role of the CNS. And my forever student mentality and desire to be the best nurse I could possibly be led me to attend many conferences. Oftentimes I went alone just because I wanted to learn, obtain my specialty certification, got my RNC NIC, and it sparked a fire within me to just keep learning. And it was very much that, like, the more I would learn, the more I realized how much I didn't know. It was this Dunning-Kruger effect. Then one day, the CNS in my NICU, my level 4 NICU, pulled me aside and told me, Amanda, you need to be a CNS. And I was like, what? Me? I don't know enough. I can't be a CNS. There's no way. Then shortly after, we were at our Certified Nurses Day, and I had a little booth for my NICU because I had created this whole study group and this program to help boost our certification rates in our NICU. It was my first ever project. And as another CNS who I didn't know, she worked in critical care in the adult world, she saw the work that I created to support the nurses in my NICU in getting their certification, and she came to me and she said, you need to be a CNS. This is CNS work. And I was like, really? Like, why are people telling me this? And it may sound a little woo. I am self-righteously a little woo. But sometimes I remember working night shift and I wondered what it would be like to be the CNS. And I vividly kind of remember being in the bay outside of the CNS's office and kind of imagining and manifesting it as my office. And now it is my office. The opportunity arose for me to apply to become the nurse educator while I finished my postmaster certificate for my CNS. And I loved it, and I was learning more and more and more. And when I was in my educator role, I was really motivated to pursue my CNS. And I was so excited because I was seeing all these opportunities to improve care, especially in areas like quality improvement and education and equity. I wanted to be the subject matter expert and the person who could identify gaps, bring research into practice, and support both nurses and babies in a more sustainable and systematic way. So I earned my postmaster certificate as a neonatal CNS in 2021 from East Carolina University. And since then, I've been able to lead QI projects in my hospital, participate in statewide and national quality improvement collaboratives, support evidence-based practices and implement those practices, and monitor and make sure they're sustained. as well as educate NICU nurses from all over the country. The CNS role, it's a role that blends clinical expertise, leadership, education, and advocacy. And for me, it's the most fulfilling way to create meaningful change. Being a CNS means I get to support not just one baby at a time, but whole systems of care, hundreds of babies, maybe even thousands of babies, because of my platform of getting to talk to you on here. I collaborate with nurses, doctors, nurse practitioners, therapists, lactation, social work, everybody, and families, of course, to make sure that we're providing safe and effective and equitable care, especially for our most vulnerable patients. If you're a NICU nurse who loves to teach, lead, and ask lots of questions, then maybe you should think about being a CNS too. We need more neonatal CNSs to help shape the future of neonatal care. So if you have questions about becoming a CNS, drop them in the comments below or reach out. I'd love to support you on your journey. And don't forget to like and subscribe for more NICU education and professional development tips.